Welcome back to Narrative Pulse. This podcast is where I dissect health stories shown on the media, but most importantly, I uncover the stories that they hide and bury. I'm your host, Chelsea, and tonight we'll be doing a deep dive into the PBS documentary, The Age of AIDS. This landmark film chronicles one of the most significant global public health crises of the 20th and 21st century. You would think that the public health crisis would make you provide a full, equitable history, but that is not the case. I'll be analyzing this film not just as a documentary that spews stories and statistics, but as a narrative shaped by choices in editing, sequencing, and voiceover. My argument today is very simple. The documentary, despite its good intentions, relies on very institutional and expert-driven viewpoints on HIV and AIDS. This view obscures the structural inequities that have allowed this condition to persist. As y'all may or may not know, this podcast focuses on medical humanities and critical race analysis. And using these lenses, I will uncover how the documentary displays whose lives are considered grievable, worth saving, or worth ignoring in this defining chapter in American history. To begin my first segment, Who Gets to Speak? I'd like to introduce a short clip from the film.
And now there were reports of sick Haitians showing up in Dr. Margaret Fischel's hospital in Miami.
One of the local channels called me up and was almost whispering on the phone, said, "Is it true Haitians brought in a deadly disease in the United States?" And I said, that better not be your headline in tomorrow's paper.
But those were the headlines when the CDC sent out a warning to physicians about the reports of Haitian immigrants with the disease.
The entire Haitian community was very upset, and I don't blame them.
In the press, it became a label. Haitians were a risk group, and the impact was felt immediately back on the...
Now that we've seen that clip, I'd like you to think about the voices that carry the most authority in a film like this. As I examine the film in this clip and look at who is shown versus who is speaking and releasing the information to the public, one thing becomes very apparent. People such as scientists, policymakers, and institutions like the CDC and WHO are granted the authority to explain causation, risk, and cure for epidemics. We are seeing videos of Haitian communities, but we are not actually hearing them. While we do hear from the CDC and essential medical figures such as Dr. Margaret Fischel, we hear words such as risk group. And this is purely based on their race and ethnicity. And I have to ask, where are the voices of activism? Where is the voices of community care? This is where the film's perspective really aligns with historian Keith Wailoo. Wailoo argues in his Spectacles of Difference, the racial scripts of epidemic disparities, that in epidemics, bodies of color are often appearing as dangerous, a mystery, or as evidence, while the systems that harm these bodies remain invisible. The clip visually marks race as a risk group and shows what researchers call hotspots, but it mutes the voices of the people who actually live in these places. Throughout the age of AIDS, the community most disproportionately affected, such as Black communities, poor and Southern, are not allowed to truly narrative themselves, but are constantly depicted throughout the film. Their experiences are detailed by distant institutional voices and experts. This narrative essentially mutes Black grief, community care, and activism that needs to be shown in the mainstream media. It is a classic example of prioritizing institutional expertise over lived experiences. Into segment 2 about respectability politics, let's pan over to a scene from the documentary.
The message that the U.S. is sending out with regard to prevention, the ABC, abstinence and be faithful. And there is some kind of a campaign to be quiet on the condom discussion, which is a disaster.
We had the ABC proposal, which is the Ugandan model. abstinence, be faithful, and then if that doesn't work, it's really A-B, and then if that fails, condom distribution as a third part of it. But we even specifically said that 30% of the funding needed to go for abstinence-based training, because this we know works.
After viewing this scene, I'd like to analyze, how do we see respectability politics and the moralization of health shaping the solutions, such as abstinence, how it shapes the good patient narrative, and who counts as a deserving victim in this film. We can evaluate the morality of health using Jonathan Metzl's framework for Against Health. He argues that health becomes a moral category, and people who get sick are oftentimes blamed for their failing to be disciplined or responsible. The documentary, by focusing its attention on an individual's choices, such as whether or not to have sex, can unintentionally reinforce this moralizing rhetoric. The documentary focuses on how the US and Uganda governments emphasized on an individual's moral choice, like abstinence, when discussing prevention, instead of pouring their time and money into structural solutions, such as providing discounted or free condoms. To further my analysis, I want to draw on NPR Blind Spots podcast, specifically the episode about titled Respectability Politics in the AIDS Crisis. It highlights how the Black communities were pressured to prove that they were deserving victims and how they would avoid behaviors that would be judged harshly by white institutions. It focused on Harlem in the late 80s and 90s and how many in the community wanted to be respected, so they ignored and exiled their friends, family, and peers who were dealing with AIDS and HIV, and how they tried to adopt the behaviors and the appearances of white culture to gain acceptance and reduce prejudice. They believed that this is how they get social change. Behaviors such as hypersexuality, homosexuality, and drug use were really looked down upon in the Black community during this time, and this was also portrayed in the documentary. Similar to the Harlem community at the beginning of the epidemic, the film focuses on the individual's behavior instead of focusing on the political climate and the health infrastructure at the time. Let's look at another scene that shows how respectability frames appear in the documentary.
And perhaps the most egregious discrimination occurred among a family in Florida whose home was burned down because their children were hemophiliacs with AIDS.
Before they were burned out, the Ray brothers, who had hemophilia, had also been forced to quit their school.
Dear Mr. President, hi, my name is Richard Bray. I have two brothers, Robert and Randy. We are hemophiliacs. We are having a hard time now. My mom and dad can't find a job. We don't have a place to live.
This is what I consider a depiction of the film showing the innocent or deserving victim narrative. Some background for the scene. Hemophilia is a blood clot disorder, and blood plasma transfusions were used to treat it. But because the blood banks that were providing this plasma were contaminated with HIV at the time, many hemophiliacs ended up contracting HIV and then AIDS. And I don't know if you noticed this, but there is very soft, somber music used in the background of the video to create more empathetic framing. But this music was not used at all anywhere else in the film when it mentions people who contracted HIV through injection drug use and sex work. This is how the film emphasizes whose lives are considered grievable and who is the innocent or deserving victim. Again, focusing on morality over mechanism, which is a critical narrative bias. Our most important task is to identify what the documentary omits. My third segment is going to be about social determinants and the opposing narratives. The omission of specific information is critical, especially when we consider why there's such a dramatic difference in the epidemic's regional impact. Dr. Charlene Flash, a physician and CEO of Avenue 360 Health and Wellness, provides a piece for the New York Times asking a similar question. She asks, San Francisco is beating HIV. Why can't Houston? Using this, I'll analyze what narratives are absent when only politicians and government institutions are speaking on an issue. In the piece by Dr. Flash, she details things such as lack of transportation, cost of medicine, and high numbers of uninsured individuals to complicate the racial stigmas that frame people of color in the South as non-compliant, culturally resistant, and irresponsible. Instead of focusing on the behaviors and culture of an individual, as shown in the PBS documentary, she highlights the structural inequities that lead to the high rates of HIV. One quote that she says is, "The tragedy is that those tools are sitting on the shelf in many parts of the country, especially in the South, where HIV rates are still rising among some groups and where AIDS disproportionately affects African Americans." This quote demonstrates that the effective tools should be available to everyone, but there is racialized disparities that persist due to unequal access, not the inherent risk behaviors. The continued disproportionate burden on certain U.S. communities after treatment becomes available cannot be explained by individual failure. It is explained by the failure of infrastructure and policy. The documentary should have really touched on how similar populations experience vastly different outcomes as a result of structural issues, but instead it chose not only to omit, but neglect to even interrogate these facts. More opposing narratives can be seen when we look at the works of the organizations such as the Black AIDS Institute. Their reports don't focus on an individual or community's morality. They emphasize social determinants of health, such as housing, racism and stigma, policing and incarceration, and health care access. These are the structural explanations that are often replaced by cultural ones in dominant narratives. Ultimately, this episode is about understanding that epidemics are not only medical events, but they're narratives that are constructions of race, power, and ideology. The Age of AIDS is a very important and informative historical film, but it's a film that we must watch critically. We have to challenge the film's racialized narrative structures. We need media to not only document disparities, but actively shift whose voices define them and whose expertise actually counts. To truly understand the crisis, we need to find our knowledge in the community. Without challenging these scripts of epidemic storytelling, we risk repeating the same mistakes, and the long shadow of inequity will continue to fall upon the most vulnerable. And that's it for this episode of Narrative Pulse. If you want to do a deeper dive into the full rationale and works cited, go check out our show notes on www.narrativepulse.org. Huge thanks to the analysts and the scholars whose work made this episode possible. I'm Chelsea, and I'll catch you next week.